Some cancer treatments, like chemotherapy, can cause damage to the heart muscle. In fact, studies show this happens in about a quarter of all cancer patients. Fortunately, there's a new specialty focused on this area, and St. Luke's is one of only 9 centers of excellence in the country. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. As we kick off Heart Month, this week we're talking about St. Luke's new Cardio-Oncology Program. With me today is Dr. Deepthi Vodnala, a board-certified cardio-oncologist and the co-medical director of St. Luke's Cardio-Oncology Program. Thanks so much for joining us today.
Thank you for having me.
So first, Dr. Vodnala, how can cancer treatment impact a person's heart and cardiovascular system?
So cancer treatments are varied, but if you take an example of breast cancer, which is the most common cancer, and some blood cancers use a chemotherapy agent called adriamycin, which when used in high doses or in combination with radiation therapy, or if patients have pre-existing cardiac conditions or pre-existing cardiovascular risk factors, they are at high risk for developing cardiac injury. And it's about 25 to 35% of patient population of cancer patients actually develop cardiac side effects from chemotherapy, and therefore at St. Luke's we have established a new cardio-oncology program where we are able to work with our oncologist and screen these patients who are at high risk for developing cardiac injury, and we try to help them by doing screening tests and medications to help and protect them before they can develop any cardiac side effects.
Wow. So what are some of the most common cardiac side effects of cancer treatment that you and your cardio-oncologist work to treat and prevent?
So each drug can cause a different side effect. Like we just talked about adriamycin, it's known to cause injury to the cardiac muscle. So it can cause weakness in the heart muscle and heart failure, whereas some medications can cause inflammation of the heart muscle and cause myocarditis. They can even cause inflammation of the sac that surrounds the heart. It's called pericarditis. They can cause coronary artery vasospasm or even ischemic events such as causing blockages and heart attacks. So different drugs have different side effects. So we just have to identify what the treatment plan is and look for what that side effect could be, and accordingly we screen our patients.
Great, fascinating. So how do you identify these patients who might be at high risk and treat them through the Cardio-Oncology Program at St. Luke's?
So I think some of the side effects are known to our oncologists and they refer to our clinic right away, but also we have collaborated with them and established a EPIC health alert, like in our medical health record, where if patients are receiving the high dose chemotherapy or a combination of chemotherapy and radiation therapy, or if they have pre-existing cardiovascular risk factors or cardiac conditions, they get a health alert saying that this patient could be at high risk and consider a referral to the cardio-oncology clinic. And that has worked well for our team, and I think the oncologists appreciate that little reminders, and we've been trying to identify patients like that.
Great. So then once a patient is established with the program, how do you treat them and follow them?
So like we just discussed, we then assess what's their chemotherapy agent and what are their risk factors and what is their baseline cardiac condition. The primary goal here is preventive cardiology. We want to protect them up front. So we try to make sure that all their cardiovascular risk factors are well controlled so they don't have any substrate that would add to the injury and cause them to have cardiac side effects. And if they already have pre-existing cardiac condition, it's not a contraindication to receive chemotherapy. We try to optimize their condition so they can successfully receive chemotherapy and have good cancer treatment and cure without having cardiac side effects.
So for those who are receiving cancer treatment, what signs or symptoms should prompt them to speak to their oncologist?
Cardiac symptoms can be something like shortness of breath, decrease in exercise capacity, tiredness. They can also have specific symptoms such as chest pain or rhythm issues like palpitations. They can have abdominal bloating sensation or leg swelling. And if you look at chemotherapy patients, they often already complain of fatigue, and they can have anemia as a result of their treatment, and they can also have symptoms of decrease in exercise capacity or shortness of breath as a result of their chemotherapy. So patients who receive chemotherapy can have symptoms that can mimic like cardiac symptoms as well.
So how can someone know if their symptoms are from chemo treatment or from something more like a heart issue?
That's a good question. It is actually very tricky to identify because the symptoms are similar, but I would say for patients to look for a cluster of symptoms, or if the symptoms are persistent or progressing, that's a good time to seek consultation with a cardiologist.
Okay. So what's your final takeaway message for those watching today?
I think it's great that cancer treatments have developed quite a bit, and now patients are able to successfully say they are cured from cancer. But I want people to be aware that cancer treatment can cause side effects. We want all our cancer patients to have a happy ending. We don't want them to fight cancer and then have to deal with cardiac health issues long-term in their life. So we want them to have an increased awareness of this and also work with their oncologist and have these high-risk patients referred to a cardio-oncology program where we can fight this condition upfront.
Well, thanks again for joining us today.
Thank you.
To learn more about St. Luke's Cardio-Oncology Program, visit stlukeskc.org/cardio-oncology. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.